Let's study something until you become a neonatologist. So this one, you have an X32 weeker who is now 3 weeks old, and you were notified that he's looking a little jaundice and his stool has changed colors. And when you look at his stool, it looks like this top one here, that whitish color, perhaps maybe you would call it a colic stool. And you get labs, including a liver panel, and you look and see that his direct bilirubin is above 1. So this infant has conjugated hyperbilirubinemia or neonatal cholestasis, and there's a long list of causes, so I will try and list some so that you can screenshot and see them, but I feel like I have to look it up every time just because there is a huge list of things to cover. So the major categories are infection, obstruction of the biliary flow, genetics, and then things like neonatal hepatitis. There can be TPN-induced cholestasis. So when we talk about obstruction of biliary flow, the major cause of neonatal cholestasis is biliary atresia. In the United States, it occurs in about 1 in 12,000 live births, but it's more prevalent in other areas of the world. You will typically see this present between like 2 to 4 weeks of life, so an infant will go from having normal stools to all of a sudden they're white in color. As part of the workup, you'll get an ultrasound and you'll see that there either is no gallbladder or there's something called a triangular cord sign, which is the remnant of the extrahepatic bile duct. Early diagnosis is super important because you will go on to have a Kasai procedure, so a surgical procedure to correct it. The sooner you have the Kasai, the better the outcome is for the patient. And then one of the genetic causes that probably gets tested on a lot with neonatal cholestasis is Alagille syndrome. And this will be given away because the infant will have other manifestations of disease. So you'll have hepatic involvement, you can have cardiac involvement, which is pulmonary stenosis, you can have tetralogy Fallot, you can have coarctation of the aorta, you'll have skeletal abnormalities, so hemivertebrae or butterfly vertebrae on x-ray, you can have renal involvement, and then infants typically have called like a dysmorphic facies, so broadened nasal bridge, deep set eyes, pointed chin. So on a test, they may say you have a baby that has neonatal cholestasis, and baby also happens to have a murmur, or they'll show you an x-ray and you'll see the hemivertebrae or the butterfly vertebrae on x-ray, and that will be a clue that it may be Alagille syndrome. But again, here's the list of the differential, so leave it up here so you can screenshot it, and hopefully it's helpful.